Hi everyone, it's Dr. Jen from GenMed. Today I'm doing a video on the top 10 things you ought to think about when you are planning your healthcare needs as you get older. So I'm going to talk about the top 10 healthcare needs that you ought to plan for as you get older. Now, number one on the list, of course, is prevention, your lifestyle, your exercise, what you're eating, how you live your life, your happiness, your joy. You can never beat a poor lifestyle. Okay? So as you get older, what you can get away with in your 20s, maybe your 30s, women as you reach 40, men as you reach about 45, everything start to pop down. So you need to put these things in place, change the habits, the lifestyle. Number two, as you get older, who will you call when you have a health need? Do you have a family member, a relative, a child, a sibling, a brother, a sister, a church friend, somebody? Who will you call when there is a health problem? Somebody that you trust and that you know will be an advocate for you. And on the same breath, do you have a network of people who are health minded, who know how to navigate the healthcare system that you can tap into? Maybe a nurse, somebody who understands how hospital system work. You must be thinking about who can I call? Number three, now to the actual medical fraternity. Do you have a doctor that you trust? A family doctor? If you have chronic diseases or specific, more complex medical problems, who is your specialist? You don't want to be going to any doctor where you not trust, where you not believe in, where you're uncomfortable with. That's a big deal. That is like you're having a party and then you choose the worst cook, the worst caterer. So you must think about these things now as you're getting older. Don't wait until you are sick. Number four, on the same breath, where will you go if you have a serious illness? So I'm not talking about now like a doctor's office, but which hospital you're going to go? Which hospital you want them carry you to? Think about that. If it is a medical matter, a heart attack, a stroke, which hospital? If it is a surgery that you might need, your appendix rupture, you have bowel obstruction, is there a specific hospital you would prefer? Do you have enough money that you could go to a private hospital? If it is private, which is your preference? How will you know your preference? You're going to do your research. You're going to find out which hospital give the best care. Where can I go for these kind of matters? Do not wait till you're sick enough to scramble around. Okay? So you must know where you want to go. And for those of you who have the luxury of flying out, maybe because you are a returning resident or you have your green card, you can go Florida or you can go back to the UK. Start thinking about it. Where would you want to go and how will you get there, etc. Very good. Number five. Now that we're talking about, you must have some money put down. People think of retirement only for, their living expenses, food and shelter and all of that. What about your healthcare needs? You must have some money put down. Every MRI, CT scan, blood work, doctor's visit, not to mention surgical procedure, etc., cost money. The medication them cost money. You must put down some money for as you get older for your healthcare needs, your vitamins, the food. You might have to be on a special diet and you have to eat this because the doctor said, right? So you must think about, I'm going to put down a money for my old age as I am getting older. And on that same breath, do you have health insurance? Have you thought about insurance in that way? Now, I know this is different people have different opinions on this. I'm not trying to put my opinion on you, but you ought to think about, do I have good health insurance? Some people may even consider, what they call it, critical illness insurance. where you get a lump sum if you get one of those major diseases. But anything that can help will help. Not true. Where am I on my list? Number 7. If you have an emergency in the middle of the night, do you have transport? How will you reach? You're old. As you get older, who is going to take you? Is somebody living there with you? Do you have an ambulance that you can press, basically almost press a button, press a call on speed dial and get an ambulance to call? Do you have an arrangement in place? You have a taxi man you can call? Right? So you must be thinking about these things as you get older and formulate a health care plan in that regard. Okay? Number 8. Where am I on my list? Oopsie. What medications will you need? You might not know fully, but what help can you get with medications? In Jamaica, we have the National Health Fund. We have the drugs for the elderly program, right? Where you get the medication very inexpensively. So you might want to sign up for these programs. Better yet, keep yourself healthy so you won't need any medication. But in the case that you do, how can you get it more cost effectively? I know a lot of returning residents, for example, they get their medications shipped down to Jamaica 3 months at a time, So you have to use whatever advantages you have to your benefit and coordinate it properly that your care is smooth and seamless. Last but not least, what are your wishes? Be very clear about your wishes. If you dying, do you want them to resuscitate? Tell your next of kin, which could be your husband, your wife, your child, do not resuscitate me, or do resuscitate me. Do you need a power of attorney? Because you can't trust the people them around you. Put those things in place. What do you want to happen if your cognitive function declines? You have dementia, Alzheimer's. How do you want things to be approached? How would you want to be cared for? What type of caregiving do you want? Do you want to be in a nursing home? Do you want to be home and have a nurse take care of you? Express your wishes very, very clearly. I would almost say document it and write it down. Have family meeting, discuss it. This is what you put in place so that as you age and life happens, you are in a more happier place because you know exactly what to do. Everybody's on the same page about your care. So those were my top, I think it worked out to be 9 tips on healthcare planning as you get older. Remember, GenMed, my company, we do primarily in-home medical care for the elders, not just the elders, we do it for everybody, but for the elders. So I have seen these matters firsthand when you're scrambling, don't know what to do, right? So these are some tips I want you to sit down and think about and put it together. I know it has been helpful. You are most welcome. Until next time, this has been Dr. Jen from GenMed. Bye.